All right, so let's talk about what a thecal sac is. Thecal sac is basically the sleeve. If our arm is in a sleeve of a shirt, the thecal sac is the sleeve for your brain and your spinal cord. And most nerves have some form of sleeve that goes over them, but when we're specifically talking about the thecal sac, we're talking about brain and spinal cord. Masses. There are a number of different types of masses, from fluid-filled masses to fatty masses to cancerous masses. It could be even something as weird as a teratoma, which is non-cancerous. It's usually like weird cells, teeth, and hair that grow. It's a mutation area. So as far as seriousness goes, that would be depending on what type of mass it is. If it's on your thecal sac, it's probably causing you pain of some sort, or your nerves to fire off weird, or any number of symptoms that caused the imaging, that kind of triggered the imaging. So seriousness, if it was me that I had a mass on my thecal sac, I'd probably be in a bit of pain, and I would want to know what type of mass it was and then go from there. If it's a fatty tumor and you're in kind of like pain and you can deal with it, and it also depends on where it is on your thecal sac. Like if it's in your low back and it's an easy removal, then go there. If it's in your brain, that's something totally different and some conversation that you get to have with your doctor. So the seriousness really is dependent on what type of tumor it is, where it's at, what your symptoms are, and really just follow up with your doctor, because I would be finding out what type it was, where it was at. I would be like weighing out what the cost and time off would be, or what my quality of life would be. Like there would be lots and lots and lots of stuff that would be weighing on my mind around what the seriousness was for me personally. So yeah, get that checked out, keep following up on it. It's not something to be left alone. Find out what type of mass it is, if it's dangerous, if it's progressive, if it's totally boring. Let's hope it's totally boring.